I got into oncology because patients with cancer have a very difficult time through their treatment course, and there are a lot of opportunities for improvement, and I thought that this field had the greatest potential for improving the care for patients. I've been involved in using precision medicine or testing a patient's tumors to help decide or help determine the best treatment possibility for roughly 10 years now. What I always recommend when someone is newly diagnosed with cancer is they first meet with a medical oncologist, and second, they should probably get a second opinion just to make sure that the general recommendations are in concert and there's not complete discordance. If they are getting two different recommendations, depending on who gave one of those recommendations, it would be ideal to seek out an expert in that specific disease or cancer type as one of those opinions, and then proceed based on one, location relative to where that physician is and where that patient is located, and also comfort level in where one decides to get treated. In the last few years, there have been some really exciting developments where specific mutations or alterations or protein changes in certain types of cancer have led to the development of treatments that far exceed what historically was achieved with other types of treatment for those cancers. I think awareness of all the potential options is important for care, especially when we're talking about someone with metastatic disease. There are some standard treatments across multiple different types of cancer that are employed, but most of the time patients will eventually need something new or different if they're eligible for additional treatment, either through the avenue of clinical trials or by testing their tumor. It may reveal some things that an oncologist typically wouldn't think of that might be helpful for that patient. For certain types of cancers, it's critical to have the discussion at the first meeting when discussing what might be the potential treatments. So for breast cancer, knowing the hormonal status of the patient and some other factors may determine if a patient's going to get traditional chemotherapy, targeted therapy, or some combination as part of their treatment. Also for patients with lung cancer, determining if they have a mutation in the gene called EGFR or translocation in a gene called ALK or some other alterations. Now also testing for PD-L1 status, determining if immunotherapy is a possibility, is important for lung cancer. For some other cancer types like colorectal cancer, where there is a percentage of patients where they may have microsatellite instability or mismatch repair deficiency, this also opens up the door to immunotherapy as a potential treatment, just as standard treatment. It also may allocate or identify patients that qualify for trials earlier rather than later. I think there are a couple things that one should ask when deciding whether or not to proceed with genomic testing. First would be the cost, which is an important factor, especially for cancer care today. Another would be how long does it take to get those results, because depending on the modality chosen, it could be a number of days to weeks. Another question that comes up in clinical practice is the tissue available readily to that ordering physician? Does it have to be requested from another hospital? And what are the typical turnaround time or wait just to get that tissue in the hands of the lab that runs that test? And then fourth, what are the results that you can expect from that assay? Is it examining the DNA, the RNA, or the protein, or is it just one of those combinations? And does the result also provide a list of potential not only treatments that are available commercially, but also through clinical trials? What I really like about the platform is a combination of things. It's got the multimodality aspect of testing, DNA, RNA, and protein. a list of potential drugs that are not just limited to targeted therapies, but also immunotherapy and then chemotherapy, which still has some importance for treating a variety of types of cancer. And the other critical piece is the turnaround time in getting those results quickly. Most of the patients that I've run molecular testing on have had that testing either to determine their first treatment or to determine what to give when their current therapy is not working. And like I had mentioned before, the longer delay in starting a therapy, the more risk you have where that patient may have a less well outcome down the road. And another important piece of the Paradigm platform is the ability to get a result, both DNA, RNA, and protein on much smaller amounts of tissues than tumor tissue than what other platforms may require.